that video was totally born of like, I have to do a video on this because these young nurses, these new nurses, they don't know what they don't know, you know?
Yeah, it's very true. And once you do hear it, you finally remember, and then, start to hear, you'll, turn your heads.
So tell me your pre-op role. What's that looking like today?
So I just finished my first week, I think on Thursday.
Okay.
So I haven't yet to start my second week, but it's a lot of like questions and, legality that you have to go through. It's not something that we were totally accounting for in our PACU. It was previous in our education, make sure the consents are signed in case we have to do like a rescue block. But now we're, in pre-op, where I'm at now, we're really having to make sure that, the patient understands and that, we're consenting for what needs to be consented for. So it was a little struggle for me because it was a lot of information overload and making sure all the checks I needed to do. But now I'm getting used to it. It's, I wouldn't say easier than what it is in PACU. It's just a lot more things that you have to, account for, I guess.
Yeah, it's different. It's
that they're safe to go.
Yeah, that they're safe to go, that we've covered everything and that they're safe to go. And one of the things that with day surgery, have you had the learning curve of difficult IV starts? People don't talk about it.
Yes, that's not something that we were doing all the time in PACU. We would get like labs, but they say that getting labs with a straight stick is a lot harder than starting an IV. I'm not too sure that I'm finding that.
Right.
It's definitely different. And then you have somebody that's, conscious. So then you got to kind of have to tell them to relax, and, you have to kind of persuade them that, this isn't like something I do all the time, but, try to get them comfortable with me trying to stick them. So I've been successful maybe like once or twice, but I haven't tried too much. I tried to try with the good veins first.
Yeah. You'll get tons of experience of IV starts in day surgery pre-op. That's for sure, hands down. In another year, you'll be able to get blood out of a stone.
That'll be good to reassuring for sure. Something I did want to mention to you about new grads being in the PACU. I think shortly after I started working there and seeing all the new grads that we were hiring, initially I thought that I was going to be an exception to that. So I was really excited to learn with a strong team, but having people leave, we don't really have a high turnover, but we did have maybe 5 or 4 nurses leave, and we're about like on a good day, we'll have like 10 nurses, and those were the usual nurses that worked with us. So it kind of hit us hard when they did leave. I was scared that I was surrounded by so much green at first, but it wasn't too terrible because our surgery volumes did decrease since COVID. We were doing like 60 to 70 cases a day, and now we're doing about 20 to 30 on the regular. A good day maybe 40, but it's I guess it gave us time to
on 10 nurses, like 60, 70 on 10 nurses.
Yes.
That's a lot. I've been at that volume, and we ran 14 to 18 nurses for, but we also did phase 2, so we did all the way through.
Oh, you did both? Yeah. We have separate pre-op and post-op, but there's not a lot of cross-training between the units, and I think that's starting to change now. No one's ever went from PACU to pre-op, which is what I was trying to do before I officially kind of said that I was going to be in pre-op for now. So it was really challenging to kind of navigate that. But I think it's really insightful to kind of be able to go in all the perianesthesia areas so that you have a better understanding of the different phases, and helps with kind of making the patient more at ease and your understanding, I guess.
Yeah. So how did you hear about PACU Nursing Minutes?
I I don't know if it was when I was asked to do the MH education. I did, reference your videos too, but our facility wanted us to kind of go over MH in a certain way so that, we could respect time for the other skills at our skill fair. So I only had about less than 7 or 8 minutes to go over it with a large group at a time. But I think in my orientation, I was like looking at videos for certain things, and PACU Nursing Minutes did come up a lot, and I thought this was really great that I could have like a video auditory format of like digesting information, because that's how I learned best. And then I realized that there were so many other videos on different contents that I just kind of stuck with it. And I think it's great what you're doing, because there really is a deficit. I think I did kind of Google like certain topics like on YouTube before, like to kind of digest certain criteria matter better, but there wasn't anything. So then I think I did start seeing videos pop up about like laryngospasms and like airway issues in PACU, and I was like, wow, this is really great that someone's covering this. So I'm really appreciative of your content and your experience and willingness to kind of do that.
Well, that laryngospasm video came out of a real life scenario. When I rolled into the second PACU that I was working in Washington, I was the 10:30 a.m. nurse, because I, come in and relieve everyone, start doing breaks and stuff in the PACU. And I rolled in, and we had just started doing kiddos, and I hear the and like no one's moving, like no one's responding, everyone's still like with their patients, and I hear and I'm like clocking in, and I'm like getting my thermometer and my telephone for the day, and I turn over and I look at this kiddo who's tripoding in their crib.
Oh man.
I know, and the SAT's like 92. The pulse ox is not alarmed, like we're going down, we're going down. And I just like drop my bag and run over and grab the ambia bag and, call for help. And I'm like, we need racemic right now, call anesthesia right now. And that kid made it. We didn't, have a respiratory arrest, but it does happen. It does happen. So, and there has been some. So, anyway, so that video was totally born of like, I have to do a video on this, because these young nurses, these new nurses, they don't know what they don't know,
Yeah, it's very true. And once you do hear it, you finally remember, and then, start to hear, you'll turn your heads. But I think our PACU's been really great about that. So I'm glad that you were able to kind of educate nurses on an emergency that you need to really address and fix before it goes to arrest. So that's awesome.
Yeah. And do you do much peds in your department?
Oh yes, Fridays used to be dental day, but I think it's kind of moved on to other days of the week too. We do dentals, and we do get general anesthesia MRIs for like pediatric patients, or like tubes, and I don't think we've had any.
Do you do the TNAs, the tonsillectomy and
Oh yes, my third day being a nurse, we had a really bad patient. I think they were only like 10 years old, but they weighed like 150 pounds, and they had a TNA, and this anesthesia provider was kind of notorious for having laryngospasms, and I didn't know that at the time. So they had racemic epi in the OR, and they were coming out requesting racemic, and she was yelling at me. She was yelling at me to grab the epi, and I thought she meant the racemic epi. Well, she meant epi out of the code card, because the racemic epi wasn't working. So that's what I learned on my third day of orientation in PACU, was that I didn't realize that you could. The next step would be epi IV for the B2, but
yeah, I mean, if they arrest, then you're going, epi's going to be your first code drug.
Yeah.
Yeah. Wow. Well, what I did with that one anesthesiologist who everyone was laryngospasming, so at that facility, we actually had an anesthesiologist in charge, AIC, or we had all
Mhm.
different terms for what that AIC stood for, but but we had an AIC, anesthesiologist in charge. And so I went right up to my AIC and I was like, look, he can't do kids anymore until you guys do some training. I was like, this is not okay to have every kiddo, because there are actually some anesthesiologists to do extra training in peds. And I get it. My husband's a flight nurse and they intubate like on the ground, after someone threw up or is throwing. I mean, their situations are
Yeah.
horrible. And he's like, sometimes airway is just that bad. But there's also
Mhm.
those providers that have every single patient. Maybe we need to re-educate on that technique and skill and ability. So
Yeah.
yeah.
I think that will probably have to be a conversation to be had then with our head anesthesia too, our AIC. So.
Yeah. Between, the director of the group,
Mhm.
and then they can have a
Yeah.
conversation with their peer. Yeah. And
Yes.
also let your manager know about it and your director know about it as well, so that, we know that there is this potential risk and we can do these interventions and, glide scopes. There's so many things that they can do with the airway these days. And we've learned so much about difficult airways. Yeah, it can be improved. So, well, let's see. So I have a question for you. What is your favorite? Oh, and I love that you use the videos. Feel free. My only request is that you just always, nobody's able to embed, so that there's no copyright law infringement.
Right.
I own the digital license on all of my images, but not necessarily the print. So I know I get a lot of people who ask me for print, and I'm actually working on a book right now to go with the
Awesome.
review course. Yeah, it's expensive though. Like all of the publishers want $40,000.
Oh my.
Yeah, I mean, right now I've got a 97.5% pass rate with all the nurses who are doing the review course, and that's pretty solid. I've been able to help 4 nurses who have failed prior to prepping with my course, prep with my course, and now pass.